Question 1. The nurse is performing an assessment on a client who has just been told that a pregnancy test is positive. Which assessment finding indicates that the client is at risk for preterm labor? 1. The client is a 35-year-old prima gravida. 2. The client has a history of cardiac disease. 3. The client's hemoglobin level is 13.5 G/dl, 135 millimoles per liter. 4. The client is a 20-year-old prima gravida of average weight and height. Explanation. Question 1. Rationale. Preterm labor occurs after the 20th week, but before the 37th week of gestation. Several factors are associated with preterm labor, including a history of medical conditions, present and past obstetrical problems, social and environmental factors, and substance abuse. Other risk factors include a multifetal pregnancy, which contributes to overdistension of the uterus, anemia, which decreases oxygen supply to the uterus, and age younger than 18 years or first pregnancy at age older than 40 years. Test-taking strategy. Options 1, 3, and 4 are comparable or alike and are average and normal findings. Also note that the correct option is the only option that identifies an abnormal condition. Question 2. The nurse is monitoring a client who is in the active stage of labor. The nurse documents that the client is experiencing labor dystocia. The nurse determines which risk factors in the client's history places the client at risk for this complication. Select all that apply. 1. Age 45 years. 2. Body mass index of 28. 3. Previous difficulty with fertility. 4. Administration of oxytocin for induction. 5. Potassium level of 3.6 milliequivalent/L, 3.6 millimoles per liter. Rationale. Risk factors that increase a woman's risk for dystocia include the following: advanced maternal age, being overweight, electrolyte imbalances, previous difficulty with fertility, uterine overstimulation with oxytocin, short stature, prior version, masculine characteristics, uterine abnormalities, malpresentations, and position of the fetus, cephalopelvic disproportion, maternal fatigue, dehydration, fear, administration of an analgesic early in labor, and use of epidural analgesia. Age 45 years is considered advanced maternal age, and a body mass index of 28 is considered overweight. Previous difficulty with fertility is another risk factor for labor dystocia. A potassium level of 3.6 milliequivalent/L, 3.6 millimoles per liter, is normal, and administration of oxytocin alone is not a risk factor. Risk exists only if uterine hyperstimulation occurs. Test-taking strategy. Focus on the subject, risk factors for labor dystocia. Additionally, focus on the data in the question, look at each option, and determine whether these are normal. Assessment F. Question 3. The nurse in a birthing room is monitoring a client with dystocia for signs of fetal or maternal compromise. Which assessment finding would alert the nurse to a compromise? 1. Maternal fatigue. 2. Coordinated uterine contractions. 3. Progressive changes in the cervix. 4. Persistent non-reassuring fetal heart rate. Explanation. Question 3. Rationale. Signs of fetal or maternal compromise include a persistent, non-reassuring fetal heart rate, fetal acidosis, and the passage of meconium. Maternal fatigue and infection can occur if the labor is prolonged but do not indicate fetal or maternal compromise. Coordinated uterine contractions and progressive changes in the cervix are a reassuring pattern in labor. Test-taking strategy. Focus on the subject, signs of fetal or maternal compromise. Eliminate options 1, 2, and 3 because they are comparable or alike and are normal expectations during labor. Question 4. The nurse in a labor room is preparing to care for a client with hypertonic uterine contractions. The nurse is told that the client is experiencing uncoordinated contractions that are erratic in their frequency, duration, and intensity. What is the priority nursing action? 1. Provide pain relief measures. 2. Prepare the client for an amniotomy. 3. Promote ambulation every 30 minutes. 4. Monitor the oxytocin infusion closely. Explanation. Question 4. Rationale. Hypertonic uterine contractions are painful, occur frequently, and are uncoordinated. Management of hypertonic labor depends on the cause. Relief of pain is the primary intervention to promote a normal labor pattern. An amniotomy and oxytocin infusion are not treatment measures for hypertonic contractions. However, these treatments may be used in clients with hypotonic dysfunction. A client with hypertonic uterine contractions would not be encouraged to ambulate every 30 minutes but would be encouraged to rest. Test-taking strategy. Focus on the strategic word, priority. Also note that options 2, 3, and 4 are comparable or alike and are therapeutic measures for hypotonic dysfunction. Question 5. The nurse is reviewing the primary healthcare providers, PHCPs, prescriptions for a client admitted for premature rupture of the membranes. Gestational age of the fetus is determined to be 37 weeks. Which prescription would the nurse question? 1. Monitor fetal heart rate continuously. 2. Monitor maternal vital signs frequently. 3. Perform a vaginal examination every shift. 4. Administer an antibiotic per prescription and per agency protocol. Explanation. Question 5. Rationale. Vaginal examinations should not be done routinely on a client with premature rupture of the membranes because of the risk of infection. The nurse would expect to monitor fetal heart rate, monitor maternal vital signs, and administer an antibiotic. Test-taking strategy. Note the word question. This word indicates the activity that the nurse should not implement without clarification. Options 1, 2, and 4 are comparable or alike and are expected activities for the nurse to perform for a client with premature rupture of the membranes. Performing a vaginal examination every shift should not be done on a client with premature rupture of the membranes because of the risk of infection, so the nurse would question this prescription. Question 6. The nurse has created a plan of care for a client experiencing dystocia and includes several nursing actions in the plan of care. What is the priority nursing action? 1. Providing comfort measures. 2. Monitoring the fetal heart rate. 3. Changing the client's position frequently. 4. Keeping the significant other informed of the progress of the labor. Explanation question 6. Rationale. Dystocia is difficult labor that is prolonged or more painful than expected. The priority is to monitor the fetal heart rate. Although providing comfort measures, changing the client's position frequently, and keeping the significant other informed of the progress of the labor are components of the plan of care, the fetal status would be the priority. Test-taking strategy. Note the strategic word, priority. Use Maslow's hierarchy of needs theory and the ABCs, airway, breathing, and circulation, to assist in answering the question. These strategies will direct you to the correct option. Question 7. Fetal distress is occurring with a laboring client. As the nurse prepares the client for a cesarean birth, what is the most important nursing action? 1. Slow the intravenous row rate. 2. Continue the oxytocin drip if infusing. 3. Place the client in a high Fowler's position. 4. Administer oxygen, 8 to 10 L/minute, via face mask. Explanation question 7. Rationale. Oxygen is administered, 8 to 10 L/minute, via face mask to optimize oxygenation of the circulating blood. Option 1 is incorrect, because the intravenous infusion needs to be increased, per primary healthcare provider prescription, to increase the maternal blood volume. Option 2 is incorrect, because oxytocin stimulation of the uterus is discontinued if fetal heart rate patterns change for any reason. Option 3 is incorrect because the client is placed in the lateral position with the legs raised to increase maternal blood volume and improve fetal perfusion. Test-taking strategy. Note the strategic words, most important. Use the ABCs, airway, breathing, and circulation. Oxygen is the only option that would improve cardiac output and improve perfusion to the fetus. The other options would not improve perfusion to the fetus. Question 8. The nurse in a labor room is performing a vaginal assessment on a pregnant client in labor. The nurse notes the presence of the umbilical cord protruding from the vagina. What is the first nursing action with this finding? 1. Gently push the cord into the vagina. 2. Place the client in Trendelenburg's position. 3. Find the closest telephone and page the primary healthcare provider stat. 4. Call the delivery room to notify the staff that the client will be transported immediately. Explanation question 8. Rationale. When cord prolapse occurs, prompt actions are taken to relieve cord compression and increase fetal oxygenation. The client would be positioned with the hips higher than the head to shift the fetal presenting part toward the diaphragm. The nurse would push the call light to summon help, and other staff members would call the primary healthcare provider and notify the delivery room. If the cord is protruding from the vagina, no attempt is made to replace it because to do so could traumatize it and reduce blood flow further. Also, as a first action, the examiner would place a gloved hand into the vagina and hold the presenting part off the umbilical cord. Oxygen, 8 to 10 L/minute, by face mask is administered to the client to increase fetal oxygenation. Test-taking strategy. Note the strategic word, first, and that the umbilical cord is protruding from the vagina. Options 3 and 4 can be eliminated first because these actions delay necessary and immediate treatment. Recalling that the goal is to relieve cord compression and to increase fetal oxygenation will direct you to the correct option. Also remember that the cord would not be pushed back into the vagina.